All right, I'm with Steve, and we're going to be doing a torque test impression appointment for tooth number 20. The implant was placed several months ago, December 26th, so it's been a little over 5 months, or a little over 4 months. It has, the torque that it was placed at was over 60 Newton centimeters, so 4 months is plenty of time for that. And so I'm going to walk you through the steps. Kelly already did the pre-scan of the area, as you can see on here. And I'm going to show you stuff on the screen as well, so you can kind of see what's going on here. Move that around a little bit. Okay. So she already did kind of a pre-scan of part of that area. Right here it says EP, that's emergence profile. Then scan body, she's already scanned the upper, but it's like, oh, you gotta mark your tooth, blah, blah, blah. Anyway, so we're gonna go through here to, no, we're not gonna let it do that. We're going to reset that one. Actually, I'm just gonna reset that whole thing. So, first step that we do is we're going to follow the instructions. Remove das healing cap. That's how the Germans say it.
Okey-doke.
That's right. Okay. So, we're going to use our little torque wrench source here, and in our goodie bags here, there's the actual torque wrench here. It has a little circle in there that fits the housing, which has the little square insert there. And then we're going to use the 2.5, that's going to be our torque test for this one for the size of implant that it is. There's a 3.0 for any implants that are 5.7 or 7.0, but anything smaller is going to use the 2.5. And then I'm going to use the 1.25 to remove the healing cap and place the scan body. I'm looking for here the dandy scan body now, and we're going to do the scan body that says zirconia, or not zirconia, Zimmer, and it's going to say P on there, which is purple, which means it's a 4.5 millimeter implant. This one was a Legacy 2, 5, it says the body is at 5.7, oh, so this was a 5.7 after all, so we will use a 3.0, I was thinking this is a 4.5, but this will be a 3.0 torque test, and then we'll use a, come look at this scan body, it's the one that says Y on it, it's a bigger, chunkier one, and Y is for yellow, the color of the implant is actually going to be yellow. Hello? Yep. You can pause. And we're back. So, it was a 5.7. I think it was a little bit of a smaller one, but we fit a 5.7 in this, so we're going to use the ZTY. Y is for the yellow, because that's the 5.7s are yellow. And so we got our little guy. It says in and out on here. It's not a burger place, unfortunately. But so we're going to take this dude. I'm going to take this dude out with our little 1.25 guy. We'll take out the healing screw. Okay, here's our little guy, and you can bring you down so people who are not 6'7" can see what's happening. And you can zoom in as much as you like. I think the lighting is not too far off, so okay. And then you can zoom in on that if you'd like to. Okay, so we just set this guy in, and we're just going to release it out. I just release it a little bit, and then I pop this dude out and remove the rest by finger pusher. And we're going to check to make sure we've got nice smooth contacts on either side. And now we're going to scan. So as we start to scan, you can come take a look over at the screen over here. Just kind of go back and forth as we're scanning. I'm going to scan, I'm going to start. It says 2 minutes, and then put everything back on. The scanner is warming up. Now it's warming up. Now you're warming up. It's like, bro, give me a minute. Okay. Alright. So we're working our way through it here. Having all the fun.
Sorry.
That's all right. That's all right. Just a little more dried off there. Come back in here. So a little clanking around in there. Angle on that for whatever reason. Window on this little guy is wet and has a hard time scanning, so that's what we were kind of feeling a little bit now. Okay, at least to the midline is what we want here. Open really big, that's great. Now we're going to try for a little bit more here. A little bit more of the gingiva there. Go and swallow for me. Good. I'm doing great. Back in here, get that mesial contact really well. We don't want any missing information on that one. And get the distal contact as well. Check the angle on that guy. Alright. Kind of dance around until we get that contact there. We don't have to get every single undercut. We just want a really good effort there. Because we don't have to, the crown doesn't have to be built against the undercut. So as we're looking at those, okay, we've got good information there. A little bit of an artifact there. That'll go away. Okay, so we skip to, we're going to mark the tooth here. Kind of zone out that area. And then we go to the scan body. Now we're going to place the scan body in place. ZTY. Y is for yellow. The implant is yellow in color on the internal. Seat it down and tighten it down. You can scoot over that way just a little bit. You might get a little better angle on that. Okay. Tighten it down, hand tightening, and I feel it slot down in, and then I'm going to hand tighten it all the way down. Okay, and then I'm going to torque it down to 15 Newton centimeters, just to make sure it's all the way snuggled down in. Dink. Okay. Double check that one more time here. 15, great. Now I'm going to do the scan again. So it wants to know what the gingival emergence is like. And then it will also want to know where the implant is. So that's why we do the emergence profile as well as the scan body. So you have to kind of start at a tooth that it already knows the reference of the tooth that it's next to, and then you get all around the scan body. Allow some of that juicy juice. Plenty of data points there, the more the merrier. Alright, double click for that. Now, If we are at all worried about the scan body not being 100% seated down, say there's a lot of tissue in the way, and it didn't feel like it felt nice and snug, solid in there, we can take an updated x-ray. I do recommend for the first 3 to 5 to 10 of these that you take an updated PA to confirm that it's seated down all the way. Okay, scan body comes out. Now we're also going to do a torque test to make sure that our implant is as strong as we want it to be. So this is the 3.0. And we snug that down in there, and we're going to reverse it 30 Newton centimeters and hope that it doesn't move on us, which it rarely, if ever, does. And then that's completed, torque test complete. Now we're going to place back on das healing collar. That's German for healing collar. It's not true. That's a real bad dad joke. But as we all know, the worst dad jokes are the best dad jokes. That's just how it works, okay? Putting that back into 15 Newton centimeters, that's it down. Okay. Now, it says remove the scan body, okay. Now we're gonna go through and it's gonna say the upper, do we like it? And we'll say, yeah, upper, good job, Kelly. And now we're gonna get the bite dialed in. So I'm gonna be open for me, Steve, okay? Bite together back teeth all the way down, medium pressure, that's great. And we're gonna do a little zigging and zagging here. I think it's just juicy, it's juicy. Okay. Sometimes it just doesn't want to pick stuff up. I gotta clean off the shield here.
Well, something about coming to the dentist gets this saliva machine working.
Yeah, your saliva is healthy and happy and getting the job done. Okay. And bite together all the way down. Good, hold that right there. Scanner is warming up. Yeah, it seems like warming for days. It has to do with it not being warm enough for whatever reason, so we're going to start over with that. Reset the bite scan. Don't funny business with the scan there. Okay, bite together all the way down. Good. Okay. This is not warming up like it's supposed to. That's an issue. That's what's causing that fogginess, which I'm noticing. I notice that it fogs up when it goes in, and it shouldn't do that. So, okay. Okay. Got the initial bite, so that's good. Okay, we got the next one here. Okay. Open for me again. Bite together all the way down. Good. Yeah, so it should not be doing that. It should be keeping that screen. Yeah, bite together all the way down. Hold that right there. Should be keeping that screen fog free, but it's not doing that, so it fogs up. So it'll basically come in and out. That's why it's causing so much issue. I couldn't figure out why it was causing so much problem. So that's not working like it should, so I get to send this back to Dandy and tell him to send us a non-defective one. Okay. Alright, so I'm gonna sit Steve up now, and now you can come watch as I get everything else ready to go. You can come over here, Kelly. Come a little closer. Okay. Alright, you got it mostly zoomed in there. Okay, good. Alright, so we click to review, processing the scan, doing all the hard part here. Okay, so it's processing everything through. It takes a minute for it to process. Once it's all processed, we can take a look, see, all right, does everything look like we expect it to? The lab will have to do a little bit of a cleanup clean up there, but generally it looks accurate to what the mouth is like. So do the start ordering. It's going to give you some defaults on that, like soft tissue model, it's included, surgical report, I'm not going to do that. You can skip a row. You liked A2 from that for that?
A2
too?
or A3, it's kind of hard to tell because the other ones are so much darker down by the
Okay.
gingival part.
Okay. So we'll see what the scan says for those teeth. So say, hey bro, what do you like about this color right here? It's supposed to be able to click on a tooth to measure its shade. It's not measuring shade. Alright, shade matching tool, you're dead to me. That's the story, bro. It does not appear to be functioning. Nice try, Dan. Okay. We'll go with the A2 then. No, that's fine. So we can come around on that side. Okay, so the goal is to blend it in. That's the number one goal. So A3 versus A2. Which one's going to disappear a little more? A little bit of a darker coloration there, so I think A3 is going to be our go-to. Goes. A4 is not a bad fit, but there's quite a bit of kind of pale white coloration. So these have too much pigment in them. So I think our A3 is going to be our go-to. So we can plan for A3. Okay. Do whatever is recommended there. Unless I do like to design, preview the design of the abutment, and so I'd like to select that one. Monolithic zirconia, cement retained custom titanium abutment, that's all accurate. And then I like to update these where the occlusal contacts like to be medium, proximal contact medium, clearance, aesthetics, I don't want any occlusal staining, natural gingival embrasures, and then gingival height, personally, yeah, they can do that, but that won't be needed. Follow adjacent anatomy. I like full tissue expansion on the emergence profile. That means that it flares a bit more. And then abutment depth on the facial, I want, because this is not in a visual area, I want it to be at tissue level for the margin on everything. If it was in an aesthetic zone, I would put it subgingivally a little bit. I like golden anodization, a little bit less than so. Do the next one, and that should do it. So I'll place our order. And that's it. We're good to go.